And so I'm going to tell you some criteria that folks can look to when they're trying to discern what is an effective program. Number one, it's got to be personalized. And what do I mean there? We know that every person's addiction story is different, and you need to find a program that is going to evaluate, diagnose, and treat you based on your individual story and not try to throw a one-size-fits-all approach at you. If they do that, it's probably not going to be effective. Number two, you need a program that offers a full array of FDA-approved options and medications, because unfortunately only 1 in 3 treatment programs offers what we know to be the standard of care, and that's medication-assisted treatment. And a lot of folks will say, but I know plenty of folks who've recovered without medication. Well, I also know plenty of folks who've recovered from their diabetes without medication, but that doesn't mean that I'm still not going to provide insulin in my clinic if I'm an endocrinologist. It doesn't mean I'm not going to provide asthma medication for someone in my pulmonary clinic simply because I know folks who've been able to deal with it with behavior change. So you want to make sure you have that full array. You want to make sure you have access to behavioral interventions, because some of the bad clinics are the ones that only give out medication. And it's medication-assisted treatment. It's got to be the full array of treatment. We want to make sure we're treating comorbidities such as hepatitis, such as HIV, such as cardiovascular disease, because you're not going to be able to be compliant with your treatment if you're worried about your other untreated illnesses. We want programs that make sure they look at addiction as a chronic disease. Again, some of the fly-by-nights will come in, detox you, and then put you back out on the street. Well, we know from a long history of success with treating folks who have addiction to alcohol that recovery takes a lifetime. And yes, it may start with inpatient treatment, but there needs to be a lifetime of outpatient support if we want people to be successful. And then finally, good programs need to have a full array of recovery support services. Again, you're not going to be successful if you don't have a home to live in, if you don't have food to eat, if you don't have a job to go to. So good programs should have referrals or connections to recovery support services so that they're not just getting you medically in an appropriate place, but they're wrapping you in an environment that's going to ensure your success long term.